Welcome to the very first episode of Healthy Conversations presented by Jackson Hinds Comprehensive Health Center. We have locations in Jackson, Vicksburg, Utica, Edwards, and Hazelhurst. If you want to follow us on social media, follow us at JHCHC MS. And if you'd like to schedule an appointment to come see us here at Jackson Hinds, give us a call at 601-362-5321. All right, this is our first ever episode. And it's October, so it's Breast Cancer Awareness Month. So we got a great episode. So I'm going to introduce to you the guest that we have today. Starting to the right of me, I have Dr. Jaleen Sims, who's the Director of Women's Health here at Jackson Hinds. Next to her, I have a cancer survivor, and we're very, very excited that you're here to tell your story. And that is Miss Lashawnda Davenport Kincaid. And then a very, very successful OBGYN, doctor, philanthropist, whatever you want to say in your own right, Dr. Edith Smith Rayford. Thank you so much, ladies, for being here today.
Thank you so much for having us.
All right, so I'm going to probably turn this over to Dr. Sims to begin with because it's Breast Cancer Awareness Month, and I want to kind of introduce why it's important that we're having this conversation, and then we can kind of go into everything.
Okay, well, that's because why are we having this discussion? It is because it is one of the cancers that is preventable. You have great mechanisms to detect it. You have access. Even if you don't have insurance, there are still ways in order to get your mammogram or to have your clinical breast exam. And you have even things that you can do at the house to help you detect breast cancer. And so as a result, it is one of those things that you can detect early and you can actually fight it and win. And so that's why it's important for us to have this discussion today.
So what we're going to do is we're going to kind of go step by step, and we're going to start with Lashawnda, your story, and we're going to slow it down because through each step, I think we're going to have a medical discussion on why it's important. So first things first, when did you find out that you had cancer?
It was the year of 22. I remember I was actually on vacation and I noticed what they called an indentation. Very, very minor. If you're not paying attention, you really would have missed it. I noticed the indentation on my right breast and, passed it off. Thought maybe it was just a bra scrap because we were on the beach having fun. 3 days later, still there. Went to Google and I'm like, this is something I need to look into. And
well, let me ask: did you normally do self-examinations for breast?
I normally do self-exams. I had a mammogram, a yearly mammogram that April. I am a nurse, so I have women's health background.
Okay.
So all of this was coming like, wait a minute. But it was June of that year. I made an appointment with my doctor, went in, got another mammogram, and at that point I was told that it was a cyst. Me, being me, I'm Googling like, no, something's not right. I see skin changes. At that time, wrinkling had formed. So I called my doctor again, like, there's something going on. Went back into another appointment. Doctor came in. I was like, this is more than just that cyst because I have changes. And immediately here comes the medical terms, wrinkling that 0900 and blah, blah, blah. We did an ultrasound in the office that day. And I remember looking, you really shouldn't look, but looked over and that classic textbook image, like right there. We did a biopsy in the office that day. And I received my results, of course, a few weeks later. It was like the longest wait ever. During that time, I was working at Women's in Flowood, taking care of breast patients, ironically. So
you kind of had, all right, I know what I need to do. I kind of know what the next steps are.
Exactly.
All right,
yeah.
Let's pause your story for a little bit. And I want to bring in Dr. Rayford. Dr. Rayford, her story sounds very similar to a lot of other women, people that have done the self-exam and thought that they had something. I want you to kind of explain, if you would, the self-breast examination and why that's important. And when you think that there's something wrong, you should go get it checked out.
Absolutely, absolutely, Stephen. What has been described is what we hear all too often is women themselves feel something different. At the point of feeling something different, patients sometimes just don't know what it is, but that gut instinct, something is different, is the hallmark of a self-breast examination. And we do encourage self-breast examinations monthly, at least a minimum of once a month. Excuse me. Also, self-breast exams is a time for women to really become more comfortable with their own body parts. We live in a state that often has a number of taboo statements about what we should and should not do at our bodies, with our bodies. And for instance, just looking at ourselves, looking in the mirror, looking at our breast. Because mammograms are great, and we're going to talk about that. They are fantastic. But over the course of many years, I've had a number of patients that between mammograms, from year to year, even 2 to 3 months later, have noticed a difference in the exam compared to a mammogram that was done just 2 months ago.
And because they were doing it on a regular basis, they noticed that there were signs there because, oh, this feels different. This feels okay.
Different. In fact, one patient at first, she said, I really thought that my breasts were just sore because I'd had the mammogram. Breasts are compressed between acrylic plates. And she first attributed it to the mammogram itself. But because of her gut instinct, she didn't let it go. She said, this soreness, this new feeling that I have, this is something different. And it was brought to our attention. And so we're able to address something 10 months earlier. 10 months make a difference.
Because they were having their own exam.
Their own self-breast exams, which are encouraged every time we do an annual visit.
Now, Dr. Sims, you're in the field a lot. And with these, when somebody comes to you, a patient, and they say, hey, doc, this doesn't feel right. As a doctor, what's your next steps as far as medical wise and also making the patient feel comfortable that, hey, this is what we're going to do and how the process is going to go?
Well, so of course I want to do a clinical breast exam at that point. And I typically go for the breast that is unaffected initially so that I can see, okay, what does the contour of this person's breast normally feel like? And then I won't ask her to tell me where it is. I try to find it myself. And then if I feel like I'm kind of like around the area, but I'm not really sure, because we do have like our younger population, they have what we call lumpy, bumpy breasts, which means that there are lots of fibrocystic changes. And so that's the reason why I would say that sometimes providers can actually slide over a mass that feels more like a fibrocystic change compared to one that a patient says, no, this is new for me. And that's why we say self-breast awareness is super important. So we'll do the clinical breast exam. And then if the person is under 30, then I'm going to send them for a breast ultrasound, because the breast ultrasound is actually going to be able to allow us to see through all of the breast densities that you can see in people that are younger. If they're over 30, they're going to go straight for a diagnostic mammogram. And I typically just do bilaterally because I want to know what's happening. I'm not going to do just one side. And so when it comes to communicating that to the patient, first I want to let her know that I hear you, I'm listening to you, and I'm with you on this. Like, I am going to do what I need to do to help us find something. Now, I've had a patient where the mammogram was completely normal. This was a diagnostic mammogram. It was normal. And when she said, no, something is still going on with my breast, I said, you know what? I'm going to send you to the breast surgeon.
Which is what happened in your case, Lashawnda. You were like, hold up, this doesn't feel right. There's something wrong here.
Yeah.
Even after you went and got it looked at initially.
Right.
Exactly.
Yeah. So the breast surgeon will say, you know what, if you've had a diagnostic mammogram and that was normal, you know what, this area that you're telling me, I'm going to biopsy it. And that's how I have found breast cancers for some of my patients where the mammograms were normal. Like actually for this particular patient, the nipple did appear a little abnormal. And you know, when you do all the 9 o'clock and all the clocks and stuff, that's for them when they are imaging, for them to go directly to that area that you are describing so that they can say, okay, this is the area that the patient and the provider have identified. Of course, they look everywhere else, but they want to make sure that they like pay special attention to that area.
Right.
And so, yeah, that's pretty much how I do it. Reassurance, I feel like, is key for patients because they want to know that they are being heard and they want to know that you are doing something about what they have told you.
Lashawnda, let me ask you. So now you've had your biopsy. Let's kind of pick it up from there. What happened next for you in your story?
Next, after the results were confirmed, of course, there was a plan of action, and I encourage everyone. When it comes to your treatment plan, my primary care doctor was involved, the oncologist was involved, the surgeon was involved, the breast surgeon, and my GYN was involved. All were on board. You know, it takes sometimes more than one person, but we went ahead, we scheduled them. I had a bilateral mastectomy. Of course, I had genetic testing done. After the mastectomy was completed, there was more surgeries. I had to go ahead and have a hysterectomy because, of course, we want to try to prevent any chances of reoccurrence to come back.
Let me just pause and say mentally, this is a tough time, right? And this doesn't all happen overnight. So
Yes.
what did you go through from a mental aspect, and what did your support system look like?
From a mental aspect, when I received the diagnosis, my husband was away in Quantico. He was at training. I had to convince him, no, you're going to stay there and complete what you're doing. You know, so it was a lot I held in and just had to, as I say, fake it at home with the kids. Didn't want the kids to know at that moment because I knew exactly what was going to happen. But I had a huge support system. I have local family member and friends really surrounded me like big time, huge. That was really how I made it through because mentally you're worried. You hear the stories. With my youngest daughter, the way she found out we were doing team t-shirts, she still didn't know because before my surgery, they had a gathering for me. It said Team Lashawnda. She said, Team Lashawnda? Wait a minute. The entire house was in tears. They say I was no good because I'm like, oh my God. But I immediately had to pull videos of survivors. Okay, this doesn't mean what you think it means. You know, this lady, she was diagnosed with not sickle cell, no story in my life, but she was diagnosed with breast cancer, and look at her. I had to show her positive outcomes.
Okay.
But mentally, it was a challenge.
Dr. Rayford, in your experience with all the patients that you've served, how important is a support system, and what does that look like for friends and family when they have a loved one who's been diagnosed with breast cancer?
Well, first, I have to echo what Lashawnda has just said. She had a network of support.
Thank
A network. A network, which means not just your nuclear family, the extended family, your friends, even your co-workers, the co-workers. It makes a difference. It makes a difference when someone is on your side, when you're going through something challenging that you have never, ever in your lifetime experienced. And it's more challenging, I have heard from my patients, when they have children, especially smaller children. So I have the greatest admiration for our survivors, our warriors, our champions, those with children, because that's another aspect of healing. Healing not just comes from the patient and their connection with God, it's all of the vessels God puts in our lives. And so absolutely, we do need the support of the children in our family as well. We need them to be strong. We need them to understand what we're going through, and that really, mommy hasn't done a thing wrong. The child hasn't done a thing wrong. Something has happened. We are addressing it, and we're going to win.
Right.
We're going to fight, and we're going to win. We're the champions. And to have champions on our team is priceless. It's those patients whom I have, Stephen, who lack support that I do have empathy for. But you can just tell the difference.
Mhm.
Yeah.
When the patients return as a patient, or if you see them in the hospital, it's a marked difference between patients who have the support, the spiritual network and family support, as opposed to those who doesn't. And it's vital. It's vital. It's vital for the patient and also us as individuals to just maintain our day-to-day strength, not look for strength next month, next year.
Right.
The day-to-day
It's day to
strength.
day. It was day to day. It still is.
It still is.
Now, Dr. Sims, let me ask you, for people that might not have necessarily that support system, maybe they just moved to the area, or maybe they, are not as, friendly or interactive, but they need somewhere to go. What are some resources that people can have when they get diagnosed that they can go to for a support system?
So there are different support groups out in the communities for lots of different health conditions, and it's going to be the same for breast cancer. So there's different organizations like the Cancer Institute, the Susan G. Komen Foundation, just different organizations that actually have patient survivors that are a part of their advocacy groups. And so as a result, those are going to be people that they can reach out to. So when you think about AA, it's going to be that same type of situation where you can go, you can share your stories, and you can learn from other people. And then they become your good friends. They become like your sisters, and they become like the people that you can call on, or that may even decide that they're going to come to a visit with you.
Mm-hmm.
Yeah.
All right, Lashawnda, let's go back to your story, okay? Because we got a lot of information here. We're taking all this in, and it's all great. So now we're trying to pick up where you left off, because we've had a lot to talk about. You were diagnosed, you went and had the exams, procedures done. What was next for you as far as treatment, maybe chemo or anything like that, if that was an option? And what was, that journey?
Thank God, and I'll say that again, thank God that mine was caught early.
Mhm.
I didn't have to undergo chemo. I sat with the radiologist. We did all of my testing. I didn't have to do radiology.
Praise
So,
God.
absolutely. Early detection is key. It
Is
matters so
key.
much. My story could have been so much different.
Mhm.
I actually couldn't be sitting here right now if I hadn't just stuck with my instincts. Something was going
Yes.
on. When I actually received the news, I was kind of relieved that, okay, I have answers.
Mhm.
I'm not just sitting here worried that something's going on and don't know what to do. My mom, I do have a family history of breast cancer. My mom, she was diagnosed with breast cancer. She's no longer here. Hers, it was late staging. And, I often wonder if hers was caught early, what difference would it have made? If she had had the same support that I had, what difference would it have made? Would she still be here? But hers was very late when it was detected. Very late.
Did she have like any genetic testing, or was it like
no
genetics that you found
genetic
later?
testing?
Okay.
And, I'm from the Delta. She was still living in the Delta. And, we have lots of health disparities in the Delta that still need to be addressed. But no, she wasn't. I also have a cousin. She was diagnosed with triple negative last year.
Oh, wow.
She passed away in February.
Oh, so sorry to hear that.
Yes.
Yeah.
Yes.
Late staging.
Yeah.
It matters. It matters.
Yes.
Well, speaking of, us talking about early detection, let's talk about some ways that we can actually detect breast cancer early. I know earlier we talked about clinical breast exams and mammograms and things like that. Dr. Rayford, will you kind of tell us about the guidelines? Like, when should one start getting like clinical breast exams? When should they start their mammograms and things like that?
Okay. Now, if you look online, If you look at the American Cancer Society, the American Task Force of Preventive Medicine, the American Congress of Obstetrics and Gynecology, you may see varying ages.
Right.
That's okay. Let's not get caught up on that. But ideally, all women should have a baseline mammogram by the age of 40, ideally.
The mortality rate is definitely higher because we catch it a little later.
Mhm.
And of course, later breast disease, as you described to us, is actually more difficult to treat.
Much
And
more
early found breast cancers are much more easy to treat.
Much more easier.
There was something that you mentioned earlier that I wanted to just kind of come back to, and we were talking about support systems. I actually have a friend who developed breast cancer in her 20s when she was in medical school. And at this point, she's never had children, but she's also had to have, a mastectomy, and then she's had her radiation and things like that. And so, we're OBGYNs, we're in women's health, and we know that a lot of people really want to breastfeed when they have their babies.
That's correct.
And so as a result, we also have to remember that that's a whole nother part of support that those moms are going to need on top of the support system that they need for, just the whole concept of I have a new diagnosis and I have to go through this therapy and all the thoughts that, okay, I may not be here with my children. You have that population of people who've never had children. They're planning to have children. And now I don't feel like I can be a full woman because I can't breastfeed my baby. And I've always wanted to breastfeed my baby. And so, Dr. Rayford, if you had this patient that had those thoughts, what would you say to that patient?
That's remarkable, Dr. Sims, because I've had a patient of that sort, more than one. Now, what I like to do is still continue all women, even those who are diagnosed with breast disease at a very early age in terms of breastfeeding. We can start early working with a lactation specialist. Now, all radiation is not the same. All chemo is not the same. All breast cancer is not the same. So when we back up and we look at the nipple is fed by the ducts, correct? The ducts go back into the lobes of the breast, the fat tissue, and then that goes into the lobules. All of that is needed in order to produce the milk. So if breast cancer has been detected and one breast has been removed, and another breast is still present, it's not a one basket feeds all. The carcinoma could have occurred in the nipples, in the duct, in the lobe, in the lobule, near the substernal area, near the axillary area, near the lymph node area. So it's all relative. So I don't want anyone to just sentence themselves, I've been diagnosed with breast cancer, because there's a voluminosity of the locations and the treatment. The treatment is so very different. You can go from one center to the next, and the same breast cancer can be treated differently. So it's not a one catch all. But getting back to the lactation specialist, if there is some breast tissue that's still healthy, remember, we have a whole breast, right? 15 to 20 lobules or lobes. So maybe there are only 5 lobes that are really functioning. We can work with those 5 lobes, okay? We may not get as much milk, but we can get some milk. And we do have breast banks. For those who are adamant about only having breast milk, we do have breast banks that are available. And then there are supplements that women can take, different exercises that I should say, I'll call them exercises, but there are different therapeutic massages that the breast can actually respond to, depending on where the activity is. And then there are tests that they can actually do just to see. You can do flow-through tests of the ducts to go back and just see which lobes are still active, which lobules are active, which part of the breast. But as I stated, it's hard to say one for all. We have to know so many different things, but it's not a sentence that because a person is diagnosed with breast cancer at an early age, that they cannot breastfeed. So no.
Beautiful.
I want to go back to the importance of getting a mammogram, because at Jackson Hinds, we just got a brand new state-of-the-art mammogram machine, and we're really excited about it. And I want to kind of, talk about the before and the after getting the mammogram, because you probably, I'm assuming, still need to get mammograms on a yearly basis to make sure there's no detection or stuff that's coming back. Why is that important? And I'll let all three of you answer about getting a mammogram if somebody's never had one, and if somebody has had cancer in the past, why it's still important to be able to get those.
Different doctors may tell you different things as far as mammograms after surgery, after treatment. One of my doctors in particular, he's insisting, yes, you get a mammogram. So I still get mammograms. I still do myself breast exams, even though I've had plastic surgery. You just never know. And you always want to be in front of anything. A head start is always good. I'm taking medication. I'm on estrogen blockers. I still follow up with my oncologist and, everything, all steps just to make sure that nothing's there. But with the mammograms, they will continue. If you've never had one, get one. And I think you may have mentioned earlier, if you don't have insurance, there's ways to get mammograms. There are free mammogram locations all the time. So.
And to that point, I wanted to highlight the breast and cervical cancer program, which is a state-funded program where different facilities actually have those fundings, and they can sign people up for their annual exam. It pays for that. It pays for the mammogram and a pap smear. And it additionally will pay for diagnostic imaging if someone has an abnormal mammogram, and it'll also pay for a colposcopy, meaning if someone has an abnormal pap smear and they need diagnostic measures to be taken. And so it's an excellent program, and you automatically qualify if you are 50 and up. And then for those who are between 40 and 49, it's based on funding. So it may take a little bit longer for your mammogram to be scheduled if you're between 40 and 49. But I'll tell you, most recently, I haven't had many patients at all being denied between 40 and 49. We hadn't run out of funding since probably around COVID time, from what I can remember. And so it's a great program. It's a way for you to see your doctor annually. It's a way for you to get your clinical breast exam, your pelvic exam, your pap smear, and your mammogram every single year for free up to age 64. Once you turn 65, it is thought that you'll now be on Medicare, and so they will not cover you past that point. Now, I want to also mention, just because you haven't made 40 yet, if you have found a mass and you don't have insurance, we can still request funding for that program for you to have some type of diagnostic imaging. And so I feel that with that information being said, I'm gonna scream it to the mountaintops because no one should go without. Like, we have lots of health disparities and basically lack of insurance and lack of, sometimes providers in different areas. Some people go without, but with this program, we know that everyone should be able to have the annual exam that they need in order to get the diagnostic testing that they may need, depending on their ages.
Absolutely. And mammograms are so important. They are just so very important. Now, of course, let's just back up to sizes of masses, which also will impact staging. It's rare that a person, unless they're in denial, does not feel a 50 millimeter mass or a 5 centimeter mass about the size of a small line. Now, that's rare that a person doesn't detect that. Okay. Then we can go down to the 1 centimeter mass, maybe the size of a peanut. Most people who are in tune to their bodies can pick that up. But when we get down to the 5 millimeter, which is about the size of an eraser head, or the 1 millimeter, which is about the size of a tip of a sharp pencil. Those are very challenging to detect, depending on location. Of course, if they're on the upper surface of the breast in front of the lobule, you can feel it. But what if it's behind the lobules?
Right.
You know, males don't have the lobules that females have. They just have the fat tissue. So if the mass is behind the lobules, those are hard to detect by self-breast exam and clinical breast exam. I would like to think after 30 years that I'm pretty good with doing clinical breast exams, but I'm not that good. So we do need mammograms.
Mm-hmm.
We do need mammograms because remember, all breast masses are not in the same location. They can be anywhere within the anatomy of the female breast. It's important to have the mammograms. Mammograms, particularly the 3D now. Way back in the day, we used to just do film mammography. Just look at a film. Film x-ray. Way back when I was in med school in the 80s, we were just looking at films. Then we went to 2D. They went on a computer. We can see an image two-dimensionally. Now we've gone to 3D. And just you can imagine with a computer in 3D, the different dimensions. Now, no, a mammogram is not 100%. I never said that. They are not 100%, but right now, mammograms still reign as one of the best diagnostic tools that we have available, particularly in identifying elusive breast masses. And they are very important. And we want to encourage patients to get their mammograms.
I want to make mention of something that you said, and you said it a couple times about the location of the masses. You know, they're different for everyone, but I wanted to just highlight to each of you that may be listening that the most common area is in the upper outer quadrant of the breast. So for instance, if you put your nipple at the middle of a cross and you go north and south, in east and west, the upper outer quadrant is going to be the one that's kind of closer to the underarm or the armpit. Right. So that doesn't mean don't do your breast exam or practice your self-breast awareness, you know, just in the upper outer quadrant, but just know that that is the most commonly found area to have been affected by breast cancer. Absolutely. And so,
great point.
We could sit here and talk about all of this all day, and there's so much more that we haven't touched on, and I'm sure that we can and we will in future episodes. But to kind of wrap up the conversation, I want each of you to kind of go and speak to whoever might be listening, whether it's somebody who's going through cancer or somebody that thinks that they might have, you know, they've done a self-breast exam and they're just hesitant to maybe go in because they don't want to hear any bad news, right? And, you know, anything that whoever is listening can take away from it. I'm just going to go around and I'll start with you, Dr. Sims, to try to give the people something that they need to hear today.
Okay. Well, so this kind of goes along with, you know, all of the like cheering that we have for, you know, our breast cancer survivors. And for that person who is like, I just don't want to know, I'm saying to you that you can go, you can fight, and you can win. And with the support of your cancer survivor sisters or your cancer survivor brothers, because we didn't mention it, but men can get breast cancer as well. And with the support of, you know, your family, your friends, you all can have that system that you and your people create to create a better situation for you and also have a great outcome, because breast cancer is not a death sentence. It's not a death sentence. It doesn't have to be. And so you can go, you can fight, and you can win.
I would say to everyone that's listening, especially to the person that may have something tugging at them, that they feel that something is wrong, that they know that something may not be wrong, or they may have gone to get seen, but they're not getting the answers that they think they deserve. Advocate for yourself.
Yes.
Self-advocacy. You have to know your body, own your body, protect your body, get answers. To the Pink Sisters, as we call ourselves, who have joined this battle, we have a huge network of support. American Cancer Society locally has, if you're on Facebook, Instagram, it's Making Scribes of Central Mississippi. I had to figure it out. Couldn't remember. It's a lot on there. But yeah, Making Scribes of Central Mississippi. Monthly events. We even had paint sessions. It's like a huge
Beautiful
network. It's a lot of support. And I didn't mention it earlier, but last Friday, the Tickle Pink event, it was sponsored by the American Cancer Society. I was honored as Survivor of the Year. Yeah, there's a huge network. Nobody fights this alone. And like I've told my coworkers, friends who contacted me after my diagnosis, you'll never fight this alone. As long as I know you, whatever I could do to lend an ear, lend a hand, and that's how it is across the board. There's a lot of support, lots of support. Even with the providers will support you. Just go and be heard.
Yes, indeed. Well, I can only echo what Dr. Sims has had to say and Ms. Lashawnda has had to say. Please, you've heard a beckoning call from two very in tune sisters to what's going on with breast cancer. We're all on the same page. We all are wearing a pink ribbon somewhere, and a ribbon and butterfly and pearls with the pink ribbon. And never lose hope. What's what I would say to people. You know, in my family, my mother and 4 of my sisters have all been diagnosed with breast cancer. And they've had various treatment options depending on their preference. And it is the preference whether a person does, if they're a candidate for a lumpectomy versus single mastectomy versus bilateral versus not having chemo versus radiation versus not having radiation. But all of my family members, thank God in heaven, they're all survivors. All survivors. From 30 years on back to my most recent sister who was diagnosed just 4 years ago. And a wide age range. My mom is 91. My younger sister at the age of 35 was diagnosed with breast cancer. So we've had a varying age range in the family. And what I want to say is every woman is at risk. Men are at risk too, not as much. You know, the statistics are much less than 1% for males, but men are also at risk, especially as we have more birthdays. And we want more birthdays.
We do want more birthdays and we want more celebrations.
Yes.
And speaking of celebrations, Jackson Hinds Comprehensive Health Center is going to be hosting a Pink Out Day here at our main clinic, Breast Cancer Awareness Pink Out Day. That's Tuesday, October 29th from 10 a.m. to 2 p.m. We're going to have guest speakers. We're going to have survivors. We're going to have vendors, raffle, and lots of info about breast cancer and anything that we can answer for you, we're going to do. We're also going to have a balloon release at 1 o'clock, to remember the memories of loved ones that might have been lost from breast cancer.
Yes.
And we're also going to do a short walk at the beginning of it too. So bring your sneakers if you guys want to come and walk with us and wear your pink. And then at 2 to 2:30, live on Facebook and YouTube on our Facebook page and our YouTube page, Dr. Sims and I are going to do a live Q&A. And what we'd like for you to do is in the comments section below of this episode, ask your questions.
Yes.
Ask any questions that you might have, and Dr. Sims and I will be more than happy to answer it. So in the comments section below, make sure you guys do that. That's big. We want to get all those questions answered.
Absolutely.
I want to thank each of you for coming on for the very first episode. It won't be the last.
Amazing.
And I hope to have all three of you on again. And I just want to thank you so much for everything that you've done. Thank you very much.
Thank
Thank
you.
you.
Thank you for having us.
Till the next
Thank you
time,
all.
we'll see you on Healthy Conversations by Jackson Hinds Comprehensive Health Center.